All right, we are not quite calling to order, so I just wanted to let everybody know it is possible that this is the last Senate Health and Human Services meeting of the session. Possible. And I've had the big fun of being on the Health and Human Services Committee. This is my third session, and for the entirety of that time, I have sat right next to or in between Senator Hardy and Senator Spearman. And I'm going to be the first one to say that I don't believe in term limits. And we are going to lose some really good people to term limits this year. And so given that this could be the last opportunity, today's meeting will be chaired by the one and only Senator Joe Hardy. So Senator Hardy, whenever you are ready, we are ready to begin.
Thank you, Madam Former Chair.
Forgot to give you the most important part there.
I was going to take off my shoe. I'd like to call the Human and Health Services meeting to order. And we will be going in the following order that is totally flexible, but we will be starting with Assemblywoman Gorlow presenting AB 216. Those of you that are on the video, we welcome your participation, and we will call on support after Assemblywoman Gorlow speaks, and then we'll from the audience here and then go on the phone. And we hope that there are people who are here that will be able to back you up, Assemblywoman Gorlow. So without further ado, we've been through this before. If you would like to go ahead and present. And that is AB 216.
Thank you, Mr. Chair and members of the Senate HHS Committee. For the record, my name is Michelle Gorla. I represent Assembly District 35, located in Southwest Clark County. I am pleased to be here today to co-present Assembly Bill 216. I'm also joined by Mary Liverati, and I hope she's on the Zoom, and she's with Administrator for Aging and Disability Division. AB 216 mandates that the state plan for Medicaid include coverage for cognitive assessments and care planning services provided to persons with symptoms of cognitive impairment. This would include Alzheimer's or dementia. Alzheimer's disease is the single most expensive disease in the United States, outpacing the cost of cancer and heart disease. And an analysis by the Alzheimer's Association calculated the direct cost posed to caregivers totaled $305 billion in 2020 alone. The Alzheimer's Association also estimates that Medicare and Medicaid covers 67% of the total costs. There are several early intervention and detection strategies that can avoid the astronomical expenses associated with late-stage dementia and Alzheimer's. In fact, the Milken Institute released a report showing that early diagnosis in the mild cognitive impairment stage could create cost savings as much as $7.9 trillion in U.S. health and long-term care expenditures by enabling better planning, management, and care. AB 216 requires a state plan for Medicaid to cover the non-federal share for cognitive assessment and care planning services for persons with cognitive impairment symptoms. By funding assessments and care planning, we can get ahead of cognitive decline to ensure those suffering and their caregivers can manage the devastation of cognitive impairment. And for families with members who may have Alzheimer's, this bill will ensure support services are in place as the disease progresses. This type of advanced care planning can prevent acute hospitalizations, which can be traumatic for individuals and their families, as well as generate unnecessary expenses to the healthcare system. I will now hand it over to Ms. Liverati from the Aging and Disability Service Division.
The privilege of the chair, would you be willing to take questions from the committee?
Yes.
Committee, do you have questions for the presenter?
You're there.
Go ahead, Ms. Liverati.
Good afternoon, Chairman Hardy and members of the committee. My name is Mary Liverati, Maryliverati. I'm a volunteer with the Alzheimer's Association, AARP, and the Nevada Commission on Aging. So today I'm representing the Commission on Aging. I'm a retired administrator for Aging and Disability Services, so I'm currently just volunteering. As you heard, this bill is going to allow our families who have Alzheimer's to and it enables the physician to spend more time with them to actually do a thorough assessment and diagnosis, and then to help with the care planning. So I just want to give you a little bit of background on dementia is not just for seniors. We do have, although we normally think of it as a disease of older people over 65, the Alzheimer's Association estimates that 5% of those with dementia have the younger onset form, and that's about 200,000 people in the United States. According to data from Nevada Medicaid, between state fiscal year 2016 and 2020, over 4,000 individuals under 65 had a diagnosis of Alzheimer's disease or another dementia that were already in the Medicaid program. So we know that it's more prevalent for 65 and older, but here in Nevada, according to a 2015 survey conducted by Nevada Department of Health and Human Services, it showed that 16%, or 1 in 6 Nevadans, between the ages of 45 and 64, reported worsening confusion and memory loss that we call subjective cognitive decline, SCD. This condition is associated with later development of dementia, but nearly half of the people in this survey had not talked to a healthcare professional about their concerns. Now, not all that people that experience or report SCD go on to develop dementia or need this comprehensive service, but a review of pertinent research conducted by graduate students at UNR's Sanford Center on Aging found between 5 and 8% of those who report SCD do go on to develop mild cognitive decline or dementia. So the importance of early and accurate diagnosis is because younger onset dementia affects work, finances, and family. Many times people are still employed when this happens. And early and accurate diagnosis is crucial also to rule out other potentially treatable conditions and to get the most appropriate treatment early in the disease process. My own experience is that my father one day thought there was an intruder in his house, called the police came. He didn't believe they were the police, wouldn't let him in the house, and a neighbor finally came over and helped convince him that they were the police. So when I heard about this, I talked to somebody in the Alzheimer's Association. They said, Mary, dementia doesn't usually be, quick onset. Get your dad to the doctor so they can see what's going on. Well, my dad had a urinary tract infection that was causing the confusion and delusion. So as soon as we got him the right meds, we didn't have to worry that he wasn't confused afterwards. So it's so important that we have that screening because sometimes it's not dementia and we can actually treat it with other medications. So early and accurate diagnosis give the patient and their family more time to make important decisions about financial and legal issues. It allows individuals time to work with their employers on work accommodations, disability coverage, or early retirement options. In addition, it allows individuals to apply for disability insurance and supplemental income benefits from the Social Security Administration. And of vital importance, it also allows individuals to access clinical trials that are ongoing across the country, and we know that we'll only find a cure with research. So this service that we're asking for here in Nevada is already covered by Medicare and by TRICARE. It was added to those programs in 2018. While Nevada doesn't cover it, there are 16 other states that have this service. We feel that there's future cost savings through the Social Security Administration, which has for younger onset Alzheimer's, it has that condition under its Compassionate Allowances Initiative, which gives anybody with the disease an expedited access to Social Security disability insurance and also supplemental security income. So this can lead to significant savings to our state and to Nevada Medicaid. After a 2-year waiting period, individuals on SSI can become eligible for Medicare. This shifts the medical costs from Nevada Medicaid to the fully federally funded Medicare program, leading to future savings. I'd like to thank you for your time today and for considering this important bill on behalf of our families with younger onset dementia. On behalf of the Nevada Commission on Aging, I urge you to pass AB 216. Thank you.
Thank you, Ms. Liberati. I think I'll back up just a step before we have questions of both presenters. And if the Secretary could please call the roll.
Senator Hardy. Here. Senator Harris. Here. Senator Kekeffer. Here. Senator Spearman. Here. Chair Ratty.
Thank you, Madam Secretary. Will the committee like to pose observations and/or questions? Senator Kekeffer, even though you shake your head no? Senator, after which Senator Spearman.
I don't have a question, Mr. Chairman, but I would say that I've worked with Mary Liverati for 16 or so years now, and her dedication to our aging population and those with dementia and Alzheimer's has not shrunk in those 16 or so years.
Thank you, Senator Spearman.
Thank you. So I guess is this real? Okay, all right. So my question would be a couple of things. The cognitive impairments, a lot of people just talk about dementia, Alzheimer's, but there's that other disease, Lewy bodies, that is really, really rare, and I don't know that we've come up with anything that will help people to get through that. So those are three things that I know are out there. Here's the fourth. One of the things that COVID does is it creates this brain fog, and I know we don't know everything about it, but are there any studies that are looking at how that might link to early onset? And I don't know.
For the record, Mary Liverati, dementia is like, think of it like vegetables. And then all of Lewy body, Alzheimer's, frontal temporal are all like the carrots, celery, potatoes. So dementia is the overarching disease. So we are doing a lot of research, but I have not heard anything specifically that's COVID related, although I can get that information for you and get back to you. I'd be happy to provide that. I had cancer treatment when I went through chemotherapy. I had chemo brain fog, so I mean, fortunately for me, I think it went away, but my husband might doubt it.
Yeah, and the only reason I ask that, if they're not doing it, then it's probably worthwhile to try to at least look at that, because we don't know enough about the virus long term. What are some of the long term consequences for that? And it seems like there may be some relation, and we'll probably know that in 10 years.
Any other questions or observations? Any other presenters?
Thank you, Chair. I believe we have some people from the State Health Division. Ms. Peterson shaking her head yes.
Ms. Peterson, if you would.
Thank you. Actually, I am from beautiful downtown Boulder City, and I can't tell you what a delight it is to be here as Senator Hardy hosts the last meeting. This one, he used to be my doctor, and it's wonderful to see you again. I want to thank the entire group for your time and consideration as you listen to my story. My husband, Drew, he celebrated his 47th birthday, living his dream. He had a degree in engineering. He owned and restored and maintained a fleet of vintage airplanes. He was an accomplished woodworker. He was an avid reader, traveler, history buff, and he was living his dream as a 737 captain for a major airline. A month after his 47th birthday, he would surrender his pilot's license, knowing he could no longer fly because he was making poor decisions. He was having trouble with numbers. There were things that he was experiencing that he knew was not normal. I continued teaching for another 3 years, but every day I came home, I never knew whether my husband would be Dr. Jekyll or Mr. Hyde. And the mood swings were increasing, the depression was setting in. He was very good at hiding and compensating for his condition. Now, I knew Alzheimer's ran in his family, but I never imagined that it would present itself in a 47-year-old, very healthy man. I will note that his mother had Alzheimer's. She died when she was 58. He has two sisters. One of them has already passed away, and the other one is in the middle, moderate stages of Alzheimer's. I took him to the doctor, and 3 years later, after MRIs, PET scans, numerous blood tests for everything, including heavy metals, what have you, the DNA blood test showed that he had the genetic mutation on the 14th chromosome, and another procedure confirmed elevated levels of tau protein in his spinal fluid. It was official. He had Alzheimer's disease. They referred to it as APOE-4, which is a rare form of Alzheimer's that presents itself in younger people. It also is responsible for familial cases, and he was only 50 years old at this time. After the diagnosis, there was a flurry of getting the family trust together, powers of attorney in place, financial considerations for a man who could no longer work. And at this point, I could not return to the classroom because I was now a full-time caregiver because he couldn't be left alone. He was forced to take a medical retirement 18 years prior to when he would have retired at 65. And a friend of ours suggested that we apply for SSI. The neurologist diagnosis was in writing. We needed that and psych tests. But finally, SSI was approved, and he was eligible for Medicare. Now, down the road, a couple of years, he developed blood clots and both pulmonary and DVT. And he was becoming a wanderer and a fall risk. He was 6 foot. I'm barely 5 foot. I could not lift him. I was sleeping with one eye open. I had cracked 2 molars. I was experiencing atrial fibrillation. And so eventually the last 18 months of his life were spent in a very nice, clean, safe group home that specialized in dementia. And they tended to his every need, but they did not accept Medicare. And so Social Security disability insurance covered about 60%, and the rest of it was out of pocket. And I was with him as he drew his last breath only 2 weeks after his 58th birthday. My husband of 30 years was now gone, and I was a widow at 55, so now what? I've been fortunate enough to be able to work with the Alzheimer's Association as a volunteer here in the Desert Southwest chapter for 5 years now. I've been doing educational presentations, facilitating caregiver support groups, and for the Senior Center for the Nevada State Veterans Home. And now I've been recently become an advocate of something that is very near and dear to my heart. And I have to say, my story is not unique in any way. The caregivers I work with repeatedly share stories. They're very, very similar. So I really urge you to consider this bill before you, AB 216. It would make such a difference to the families of those who are affected by younger age onset, and to just have a timely diagnosis and be able to form a care plan before it becomes a crisis. So I thank you very much, all of you, for your time and for the opportunity to share my story and to share Drew's story. Thank you.
Thank you. Appreciate it, Amy Peterson. Appreciate what you've done and how you've done it. And I think we have another presenter. Ms. Gorlow, who would you like to have?
If Mr. Young's ready?
Good afternoon, Chair Hardy, to the committee. Ms. Lynch will provide testimony in neutral. There was a fiscal note on this bill that was removed because we believe that this is a savings based off of delaying care into a nursing facility and providing other services such as home health and personal care services. And so Ms. Lynch will speak to the policy in testimony, but I can answer any questions the committee may have.
Thank you. Thank you, Mr. Young. Go ahead. Ms. Lynch? Is there anyone else in favor that you have presenting?
I have no more presenters. Thank you.
Thank you. If you can step away if no one has any questions, we'll have those in support in the room. If they could come forward. Anybody on the phone that's in favor of AB 216?
Thank you, Chair. Callers, to testify in support of AB 216, please press star 9 now to enter the queue. Will the caller with the last 3 digits of 528 please slowly state and spell your name for the record? You may begin.
Mr. Interim Chair and members of the committee, for the record, my name is Barry Gold, Barrygold, and I am the Director of Government Relations for AARP Nevada. I first have to apologize to Mary Liverati in advance. She's a dear friend, but I heard her say earlier, dementia isn't just for seniors. You know, I think we need to put that on a t-shirt maybe. And I know several people who would do very well wearing that t-shirt. But anyway, we've heard what the bill does, and we've heard why it's important, and we've heard about the terrible impact this disease can have and all cognitive impact can have on people earlier in their lives. So I'm not going to go ahead and read my 3 paragraphs of pithy, that's P-I-T-H-Y, and relevant testimony, but I'm simply going to say AARP Nevada, on behalf of, by this time of the legislative session, everybody has memorized how many members we have across the state, thousands and thousands and thousands, strongly support this bill and urge the committee to pass it. Thank you.
Thank you, Mr. Gold. Anyone else on the phone in favor of AB 216?
Will the caller with the last 3 digits of 139 please state and spell your name for the record? You may begin.
Thank you, Chair Hardy and committee members. Misty Grimmer with the Ferraro Group representing the Alzheimer's Association. I certainly have nothing more powerful to say than what Ms. Peterson's story already conveyed. So I will just let you guys know that we are in very, very strong support of this bill. And I hope that you move it right out of that committee today so we can make sure it gets through the process. Thank you.
Thank you for your enthusiasm. Anyone else in favor of AB 216?
For the callers that have just joined us, we are on testimony in support of AB 216. If you would like to provide testimony in support, please press star 9 now to enter the queue. Chair, at this time, there are no additional callers wishing to provide testimony in support of Assembly Bill 216.
Thank you very much. Anyone in the room opposed to AB 216 at the peril of your life? I may have joked a little bit there. Don't be intimidated. Anybody on the phone opposed to AB 216?
Callers, if you'd like to testify in opposition to Assembly Bill 216, please press star 9 now to enter the queue. Chair Hardy, at this time, there are no callers wishing to testify in opposition.
Thank you. Is there anybody in the room neutral on AB 216, if they could come forward? Seeing none, anyone on the phone? Oh, on the phone in the Zoom. Ms. Lynch, are you, as I understand it, neutral on AB 216? If you are, go ahead.
Yes. Thank you. My name is Erin Lynch for the record. I'm with the Division of Healthcare Financing and Policy. I'm the chief of the medical programs unit. And for AB 216, with reprint 1, we do have a fiscal note posted and with a $0 impact.
Thank you very much. Anyone opposed on the, or neutral on the AB 216 on the phone?
Callers, if you'd like to provide testimony in a neutral position for Assembly Bill 216, please press star 9 now to enter the queue. Will the caller with the last 3 digits of 584 please press star 6 to unmute yourself? Thank you, caller. Please state and spell your name for the record. You may begin.
Good afternoon. My name is Jennifer Richards, JenniferRichards. I serve as the Chief Elder and Disability Rights Attorney within the Aging and Disability Services Division for the state of Nevada. We just wanted to go on record today thanking Mary Liberati and all the members of the Commission on Aging for their leadership in working and collaborating on this bill. We believe that this bill will have a tremendous impact on the populations that ADSD serves. And I would also like to add that this bill may reduce unnecessary guardianships in our state, unnecessary hospitalizations in our state, and we appreciate the input on the fiscal note from our colleagues at DHCSP. Thank you.
Thank you very much. Anyone else neutral on AB 216 on the phone?
If there are any additional callers who would like to provide neutral testimony for AB 216, please press star 9 now to enter the queue. Chair, at this time, there are no additional callers wishing to testify in a neutral position.
Thank you very much. We'll now allow the sponsor to say any last minute or closing up remarks.
Thank you, Chair, and thank you, members of the Senate Health and Human Service Committee. Really appreciate your consideration for this bill. And if I could take a moment of privilege, I would also like to ask everyone to come join me for the Walk to End Alzheimer's in October. It's October 2nd in Sparks and October 16th in Las Vegas. So thank you very much.
Thank you, Assemblywoman Garlow. Appreciate you bringing this forward to us. In view of what we're doing right now, we would like to work session this, and is there any discussion from the committee? I hear a motion to pass and a second by Senator Spearman. Is there any discussion on that? Hearing none, all those in favor say aye. Aye. All those opposed, nay. It passed unanimously. Thank you very much. We'll now open the hearing on an Assemblyman Ornlecker. I think you are here and you win. We'll close the hearing then on AB 216 and open the hearing on AB 191.
Thank you, Chair and members of the committee. For the record, I'm David Ornlecker, representing Assembly District 20. I'm here to present Assembly Bill 191, which requires Medicaid to reimburse services provided by community health workers. And by doing so, that will increase the capacity of our healthcare system for prevention and early treatment, and that will lead to considerable cost savings. And I will now turn it over to my co-presenter, Jay Colbert-Clausell, who will tell us more about the role of community health workers. Dwayne Young is here to answer any questions about the fiscal implications. Thank you.
Committee have any questions they'd like to ask the presenter at this time? We will turn it over then to your Jay Colbert-Clausell. Thanks.
Thank you, Chair Hardy. My name is Jay Colbert-Clausell, and I am the Program Manager for the Nevada Community Health Worker Association based in Dayton, Nevada. I have a master's degree in social work and am proud to see our state and medical employers supporting our community health workers. Presenting this abridged AB 191 slideshow today is a privilege. The full presentation is recorded in the March 8th Assembly Health and Human Services meeting. CHWs are community members who bridge the gaps in Nevada's healthcare system. CHWs come from underserved rural and urban communities. They represent the diversity of our state in the medical service sector. Medical CHWs provide education and training for patient self-management and are defined in NRS 449.0027. The Nevada Division of Public and Behavioral Health trialed CHW service in our state and found a nearly $2 savings for every dollar spent. ER visits decreased 14%, urgent care by 6%, acute admits by 18%, and repeat hospital visits reduced 20% when CHWs were utilized to manage chronic illnesses. Additional information may be found on the nvchwa.org website, and we have submitted a list of supporting groups. Thank you very much for bringing AB 191 to the Nevada Senate.
Questions from the committee? If I may then, when we consider sharing the non-federal share of expenditures, can you tell us, what that entails and who gets paid? Is it the physician assistant, the advanced practice nurse, or is it the community health worker, or how does it work?
Deputy Administrator Dwayne Young, for the record. Chair Hardy, we've discussed this, I know, several times in several sessions, and this has evolved. We would stand this up as a separate provider type. And so the community health worker would enroll into Medicaid, but they would be linked to either that physician, that APRN, or that physician assistant. They themselves would bill linked with that enrollment linked, and they would be reimbursed as a separate provider type.
Where does the money go?
Dwayne Young, Deputy Administrator, for the record. The money goes to the enrolled provider. And so that provider could have another arrangement with their supervising provider in which they do the billing collectively for the group. But that is not an arrangement that Nevada Medicaid is involved in.
So the money goes directly to the community health worker under the auspices of the license of the physician, nurse practitioner, or physician assistant, correct?
Correct.
Any other questions by the committee? Senator Spearman.
Thank you. So I have a question, and my question is about what, if anything, are we doing or do we need to do to make sure that the community health workers are representative of the communities, the diverse communities here in Nevada?
Deputy Administrator Dwayne Young, for the record. And so I will start, and I may pass this off to Mr. Colbert-Calazar. But I believe that there is language actually previously within NRS, which focuses in the regs that the community health workers must be representative of the communities that they serve. We know that the existing community health workers that are being utilized through community coalitions, through local hospitals, federally qualified health centers, through grants, are representative of that community and are also bilingual or multilingual in order to reflect the needs of the community in which they serve.
So thank you. So I guess what I'm asking a little bit more pointed, it's in the regs, but sometimes the regs don't translate into reality. And so my concern would be if this is going to be implemented, to make sure that it's even with respect to and representative of the communities that we serve. Nevada's getting more gray and Nevada's getting more diverse. But if we're not intentional about making sure we're reaching out to BIPOC communities, to make sure that the people who are in those communities that are already doing the work, that we're partnering with them, getting them on board, giving ideas, however that looks. And I'm saying that because of of the things that have not happened during COVID.
So if I may speak to that through you, Chair Hardy. It is absolutely the concern. We do not have a diverse health workforce in the state of Nevada. And community health workers are the easiest door in. So we're starting programs at high schools. The CHW program itself, we're bringing in new instructors who represent different communities. So we have an instructor from Fernley. We're bringing in an instructor from a urban Las Vegas community who will fortunately start in June. And so by representing everybody in those instructors and in the current work pool that we have, we're able to bring in a more diverse workforce that can then go on to social work positions or pursue higher nursing degrees. So it's a door in to people who haven't been or had access to these positions before.
Thank you. That's very insightful. If I can be so bold, not that you don't know, but just humor me. A couple of things that I think we might do better as a state when we're talking about reaching out to BIPOC communities is to go to the people that know the people, like churches, fraternities, sororities, community organizations, those sorts of things, and listening sessions to find out what we need to do differently, if we need to do something differently, how often we need to do it differently, and to probably have a way to begin to relate to the community so that you can develop that trust. And I think this is a very good bill. But my fear is that if there's not any intentionality about making sure that we're reaching out and we're acknowledging diversity, that it will land the same way every other bill lands. And if we're not intentional about developing some type of a template to do outreach with diverse communities, then nothing happens except good intentions that really don't go anywhere. And please don't hear that as a slam. I'm just saying, generally, if whatever we don't plan on really doesn't happen.
And through you, Chair Hardy, I absolutely agree. I think you've hit the nail on the head, and we are applying for funding to hire CHWs directly in these communities from every source we can find out there. So we have COVID relief funds that are specifically targeted to Hispanic and Native American tribal agencies. We're looking at updating our curriculum by bringing in consultants from the communities who can help review all of the language and work to address those issues. So I think you're absolutely correct. And like my office is actually right above the Healthy Communities Coalition food pantry. So I get to be like right there with the communities that we're serving, and so that we are listening and we have that voice.
Any other comments? I have a question. When a physician assistant, for instance, is working with the physician, there's usually an agreement that we have to have in place, and the Board of Medical Examiners is interested in what that agreement is, and that we have a official designation who we are supervising. This probably has been done in other places, or it's being done, and or we're considering it. What are the ways that those agreements have worked or working, or how we can not recreate the wheel but get something done that physicians are then comfortable with the liability issues they have and the board certification they have, and how does that work? And Mr. Ornlecker, Assemblyman Ornlecker, would probably like to field that. Thanks.
Actually, I'll defer first to Mr. Colbert-Clausel, if I may. David Ornlecker for the record.
Go ahead.
So this is a really important Oh, or through you, Chair, if I may. This is, again, a super important question. Most states that have community health workers have a much more broad supervision provision than we're looking at proposing here. And I think our very conservative method is a great way to start this program and run it. Like these other programs will use social workers and of these other different provider types to be the supervisor. But in Nevada, that's not what's being proposed here. We're looking at a very structured setup. The community health workers have a license that has been approved, and we're getting a lot of momentum and people who are going for that license. They're doing continuing education classes. They'll be working with the physicians and the APNs and those physician assistants with a lot of support, both for the employer who are working with the Medicaid office and from the association, and then from national partners as the CHW programs are expanding in Texas and in California. To really make sure that we catch things early. We know that these CHWs are qualified to do the tasks that they're doing and that they're able to connect to the tasks that they're not able to do. And so there's kind of two pieces to your question. There's the one side of this following the cash that goes. And I think our Medicaid office has looked at that, and I could let them speak to that. And then the side that I'm more looking on is that responsibility and that accountability piece, because we want this program to be successful. We need more outreach workers. We need more touches with the clients, or the healthcare clients in the state of Nevada. And that's what this is really looking to expand, so that we can reduce and not demand so much of our healthcare systems, because we're catching things so early. We're teaching things in a culturally relevant way, in the appropriate languages, and directly in the communities, in the schools, in the homes, in the churches that people actually live, and where they're going to build those trusting relationships.
Thank you. I appreciate that. When I looked at your NRS 449.0027, describes the community health worker as a person who is not licensed, doesn't require a license. So are you talking about licensing someone separate and distinct, or certifying someone separately and distinct from this?
Great question, Chair Hardy. So a CHW is not required to have a license to be called a CHW, but I believe for the Medicaid reimbursement that license, they'll need to pursue that, and I can defer that to the Medicaid office.
Mr. Young?
Dwayne Young, Deputy Administrator, for the record. That is correct. For the purposes of enrollment, they will need to have that license and present that at the time of enrollment.
So is there a license under a board and a fee for that license?
That is correct.
Is that in the bill?
That has already been created, and we currently are running the classes. So a lot of employers are using the program, even though this hasn't been tied with the Medicaid. So this bill isn't about creating the program. The program's already there. This is about that Medicaid reimbursement for those staff members who are serving those Medicaid clients.
I guess I'm trying to catch up with you then. So I'm looking, where is it that we have this license? Is that in Chapter 222? Is that where the license is, Mr. Young?
I would need to, Dwayne Young, for the record, I would need to confer, but that was accomplished in the 2015 session. Perhaps Mr. Robbins could provide this information.
Our expert on legal and where it's found, Eric Robbins, is probably going to give us an answer to this.
Eric Robbins, LCB Legal. As far as I'm aware, community health workers themselves are not a licensed profession under Nevada law. However, community health worker pools are licensed under Chapter 449 of NRS.
Can you help us with what a pool is then?
Yes, a community health worker pool means a person or agency which provides for compensation and through its employees or by contract with community health workers the services of community health workers to any natural person, medical facility, or facility for the dependent. The term does not include an independent contractor who personally provides the services of a community health worker or a facility for the dependent or medical facility other than a community health worker pool, which provides the services of a community health worker. So if they're working for another type of facility, they'd be covered by that facility's license. But if it's an entity that arranges for community health workers to provide services to people or facilities, then they would be licensed as a community health worker pool.
So what this bill then would be doing, if I may, this bill would allow a pool to be paid, and then the pool would pay the individual community health worker, but the community health worker would not technically be an independent person other than if they're under the pool.
Well, that's partially right. I think that it would be a pool could be paid under this, but it also could be if a community health worker is working for a facility, then they would get paid through that facility, or if a community health worker is working for a physician assistant, or an advanced practice registered nurse in their individual capacity, they could also get reimbursed through that provider under this bill.
Thank you. I think that clarifies that the community health worker then would be getting payment from either the supervising physician assistant or advanced practice nurse or the pool. Those are the four options that they would have.
The pool or the other type of facility that they're working for.
Okay. So it could be a hospital, for instance. It could be
It could, yes, could be any type of medical facility or facility for the dependent licensed under Chapter 449.
Madam Real Chair.
Thank you, Senator, and I appreciate the line of questioning, and I think we're getting to clarity. The community health worker models that I'm familiar, they're generally working for agencies, many nonprofit agencies. So I think the way that I understand it is they have to be supervised by the list of licensed professionals that are in the bill, but not necessarily sponsored by, I'm not sure that that's a legal term, but the agency will be paying them. The agency would also be paying the physician or the APR, whatever the list of licensed professionals is that they can work under here. The physician's assistants, or APRNs, but not necessarily a direct pay relationship between those two, but there always has to be a supervisory relationship between those two. Is that correct, Assemblyman Ohrenlichter or Mr. Colbert-Klassel?
David Ohrenlichter for the
That
record,
is
I believe so. And Jay, if you want to confirm.
Yes, and the certification we have is through the Nevada Certification Board, so it's not a license.
Yeah. Similar to the peer support specialist bill that we heard earlier this session.
So the agency, the facility, would then have requirements for who works for them and who they supervise, and thus they would be in a position to receive remuneration through this bill for the services that a community health care worker would be doing.
Yeah, the big step forward here, as I understand it, is a sustainable business model that allows us to employ more of these critical members of the healthcare team.
And be reimbursed for them.
Yes.
Senator Harris, you had something.
Thank you so much, Chair Hardy. I was wondering if it was possible for you all, when you are, implementing this program, to think about partnering with the Office of Minority Health and Equity to possibly do a little bit of outreach and gain some cultural competency for these community health workers.
Chair Hardy, if I may answer, we are partnered with them and are looking at hiring some of their stakeholders to be on our staff.
Thank you, and thank you. Any further comments on the intricacies of how this all works? Assemblyman Ornlicker, or?
It's much more complicated than I thought. Thank you for your elaborating on this.
Mr. Young? Are we understanding it according to your understanding as well, Mr. Young?
Dwayne Young for the record. Yes, Senator Hardy. And as Chair Ratty has pointed out, we just require that, and I use the term licensure, it's licensure or certification. In this case, certification as a requirement of enrollment. That physician assistant, or APRN, is the supervisor, but yes, they are certainly employed through agencies, as I pointed out earlier, federally qualified health centers and a myriad of Medicaid providers. And this would provide that reimbursement back to them. But the arrangement may be multivariate based on their current payment arrangement.
And then I guess to Mr. Colbert-Closel, is there a criteria or a curriculum for the community health care workers before they're hired, or it's up to the facility and agency or physician, et cetera, that hires them, that gives them the scope of practice, I'll call it?
So yes, Chair Hardy, we do have a curriculum, and we did that with the Nevada Certification Board, kind of created that and workshopped that. We're looking at updating that curriculum a little bit right now, but those classes are ongoing, and we can't open enough classes. They're very popular. It's an 8-week program, just to give you kind of a scope of that distance. There are 2 other programs that do CHW education in the state. One is at the College of Southern Nevada, and then another one is at Truckee Meadows Community College. And all 3 of us work together and apply for funding jointly.
Thank you. Any observations or questions about that? So as I understand it, then what we're doing with this bill is we're going to get a stream of income that will help the community healthcare workers have motivation to become one, to work within the system, and to be able to expand all the healthcare delivery. Particularly, we're interested in health professions shortage areas, the BIPOC communities, the zip codes that are recognizing that. And it sounds like you're committed in that same direction. Is that all true? I see heads shaking.
That is true.
Thank you. Any other comments? If we could have those who would be in support of this in the room come forward. Go ahead.
Thank you, Chair Hardy. Members of the committee, for the record, my name is Katie Ryan, and I'm the System Director of Government Relations for Nevada for Dignity Health St. Rose Dominican. We provided a letter of support to the committee. We're so grateful that the Interim Health Committee took this up as one of their issues last interim. And during normal circumstances, we have CHWs and promotores out in the community doing this work, teaching about disease, chronic conditions, et cetera. Obviously, it's been a little bit different with the pandemic, but we're very excited. We've been doing it virtually, but we're very excited soon to get back to our normal schedule. If you have any questions, I'm here to answer them.
Next.
Thank you, Chair Hardy and committee members. My name is Kendall Lyons, and I am the Director of Health Policy for Children's Advocacy Alliance. I sit here not only as an advocate for children and families, but also as a former community health worker for one of the Medicaid managed care organizations in our state. I've seen firsthand how impactful a CHW is to families new to our state or new to the Medicaid system. The ability to connect directly with someone like a CHW who understands the complicated healthcare system and resource landscape in our state helps minimize the stress that makes accessing healthcare feel burdensome for so many. In my nearly 2 years as a CHW, I connected people with their primary care doctors, advocated for them to ensure timely delivery of their prescription medications, and connected them with community-based resources that helped minimize their barriers to care, such as transportation, energy, and food assistance programs. This bill will not only save the state money, but it will also help people. And any legislation that can do both is just good policy. So on behalf of Children's Advocacy Alliance, I strongly support AB 191, and I hope you do too.
Thank you. Anyone else in the room right now in support? And if not, we will turn to the phone on AB 191 on support.
Thank you, Chair. Callers, if you'd like to provide testimony in support of AB 191, please press star 9 now to enter the queue. Will the caller with the last 3 digits of 770 please slowly state and spell your name for the record? You may begin. Once again, caller with the last 3 digits of 770, please slowly state and spell your name for the record. You may begin. And it looks like you may need to unmute yourself from your phone. Chair, it seems that this caller is having some technical difficulties. I will move on to the next one and then circle back if that is all right.
Correct.
Will the next caller with the last 3 digits of 918 please slowly state and spell your name for the record? You may begin.
Thank you. My name is Leanne McAllister, Leann, MC, capital ALLISTER. I am the Executive Director of the Nevada Chapter of the American Academy of Pediatrics. Today I offer support on behalf of the Nevada AAP in favor of AB 191. Community health workers play a crucial role in the dissemination of medically accurate information to various communities. In one specific study, research showed that community health workers significantly improve the health outcomes of children with asthma. Community health workers have great potential to improve kids' access to health care and increase families' adherence to providers' recommendations. The Nevada AAP currently has more than 250 members, most of whom are board-certified pediatricians, both primary and specialty care. Members also include pediatric nurse practitioners, physician assistants, pediatric residents, and medical students, all of whom live and work in Nevada and have dedicated their professional lives to the health of all children. Thank you for this opportunity to speak in support of AB 191.
Thank you, Ms. McAllister. Next.
Will the caller with the last 3 digits of 770 please slowly state and spell your name for the record? You may begin.
This is Joan Hall, JoanHall, representing Nevada Rural Hospital Partners. Good afternoon, Chair Hardy and members of the committee. I'm here today to support AB 191. Community health workers are trustworthy individuals who share life experiences and culture with those they serve. CHWs are trained to navigate systems such as healthcare, housing, insurance enrollment, and transportation. And they link community and clinical services to help people in their own communities lead healthier lives and understand disease and injury prevention measures. During COVID, in the rurals, we saw firsthand the value when CHWs reached out to our migrant farm workers and tribal members with information and education on preventative measures, assistance in getting testing, and recently vaccination. Reimbursement for these services is important and is more affordable than any other alternative. We've been working many, many years on this concept, and I urge your support for AB 191. Thank you.
Thank you, Ms. Hall. Next.
If there are any additional callers who would like to provide testimony in support of AB 191, please press star 9 now to enter the queue. Chair Hardy, at this time, there are no additional callers wishing to provide testimony in support.
Thank you, Broadcast. If we could have those that are opposed to AB 191 in the room come forward. Seeing none, we'll go to the phone line. Again, opposed to AB 191, if any.
Thank you, Chair Hardy. Callers, if you would like to provide testimony in opposition to Assembly Bill 191, please press star 9 now to enter the queue. Chair Hardy, at this time, there are no callers wishing to provide testimony in opposition.
Thank you. If any are in the room in neutral position on AB 191, if they could come forward. Seeing none, we will return to the phone call for anyone neutral on AB 191.
Callers, if you would like to provide neutral testimony for AB 191, please press star 9 now to enter the queue. Chair Hardy, at this time, no callers are wishing to provide testimony in a neutral position for AB 191.
Is there one on Zoom that would like to be neutral on AB 191?
Yes, this is Erin Lynch for the record. I'm with the Division of Financing and Policy. I'm the Chief of the Medical Programs Unit. And for AB 191, they're testifying in neutral and that we have a cost savings that has been posted as a fiscal note.
Thank you very much. Are there any comments from the sponsor, Mr. Assemblyman Ornlicker? If you could come and make any closing comments you'd like.
Sure. Thank you, Chair. David Orient-Licker for the record, Assembly District 20. Thank you very much for your careful consideration of this, and I hope we can get your support. Thank you.
Thank you. Any feelings from the committee? I have a motion from Senator Kieckhofer to pass, and second from the real chair, Senator Ratty. Oh, we're missing somebody. We're moving forward anyway, and we will accept Senator Harris's vote when and if she gets back. Thank you. Those in favor of the motion, please say aye. 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 Any opposed, say nay. Motion passes. Thank you. We will close the hearing on AB 191 and open the hearing on We will open the hearing on Assembly Bill AB 256 and have the proponent take a deep breath and come to the table. In and out. Assemblywoman Summers Armstrong, if you could present AB 256, we'd appreciate it. Thank you.
Thank you, Senator Hardy and members of the Senate Health and Human Services Committee. I think that's where I am right now. Please, someone tell me. Okay. All right place. My name is Chandra Summers Armstrong, and I am the Assemblywoman for Assembly District 6. Before you today to present Assembly Bill 256, which would enable Medicaid coverage for non-medical doula support services. I'm joined here today by our fearless community advocate, Quentin Savoy of Make It Work Nevada, Miss Jolena Walker of the Kijiji Sisterhood. We have Lauren, is that Lauren? No. Aaron? Okay, I'm confused. And we have Mr. Dwayne Young from HHS. I actually believe we have Lauren on the phone. Lauren Calagridis of Thrive Wellness of Reno and the Reno Doula Project. And there's one more person on Zoom. I don't recognize the face. If you could please just wave. Well, she doesn't hear me. That's all right.
That's Erin Lynch. She's with.
Oh, okay. It's been a day. All right. You can tell I'm nervous. All right. So let me start this presentation with a personal story. In January 1987, I found out I was pregnant with my first child. I was living with my first husband in the small town of Fisbeck, West Germany, and we were stationed in an Air Force forward operating location. The nearest military hospital was over 2 hours away in a port town of Bremerhaven. Because of the distance between where we lived in Fisbeck and the military army hospital in Bremerhaven, I was given the option. I could either go to Bremerhaven 2 weeks before my due date and stay in the hospital to have my baby, or I could have services at the local German hospital. So I decided I'm going to have my baby in the local hospital. They've got to have some great folks here, and so I signed up. I didn't know it at the time, but part of the continuum of care in that region was the services of a midwife. Her name was Gisela Bussa. She was a stout, dark-haired, no-nonsense woman who spoke very little English. And although she had a firm demeanor, Frau Bussa exuded kindness and competence. She was just what I needed as a first-time mom. I was 5,000 miles away from my mom, having my first baby, and she provided everything that I needed at that time. Our first meeting was at my house. My landlord's wife acted as the interpreter, and Frau Bussa asked lots of questions. She made suggestions about placement of the baby in the window every day. I didn't realize that even black babies need vitamin D and need to be in the window. She talked to me about how to position the baby during the day so that we wouldn't have aspirations and SIDS. And I was able to attend Lamaze classes and Leche League classes in her home. She had a 2- or 3-story house, and the first floor, padded room, and there were probably a dozen of us young moms that would go to her house on a weekly basis for this training. She was my rock during the birthing process. Epidurals are not common in their healthcare delivery system, and that's where Lamaze came in, and she really helped me get through with breathing, concentration, touch, and encouragement. And after I had the baby, she visited me every day in the hospital. In Germany at that time, new mom stayed in the hospital for 6 days. 6 days. And you can imagine that I felt fabulous because this woman who thought she was my mama made sure that I got the best care possible. I tell you this story to illustrate the difference it can make when a mom has support before, during, and after delivery of her baby. Current best practices tell us that non-medical doula services are great and great at providing support for the mom, while the midwife's job and the physician delivers the baby. And so I just want to share that with you all, to let you know that this is a personal issue with me. When Quentin came to me with this legislation, this is the first thing that came to my mind, was this amazing experience I had. And I'm just really excited to be here to present to you. And at this moment, I'd like to turn the presentation over to Mr. Quentin Savoy of Make It Work Nevada, and he can explain how his organization is engaged in advocating for this bill.
Anyone have any questions of the presenter? Go ahead, sir.
Thank you, Chair Hardy. Thank you, Assemblywoman. For the record, my name is Quentin Savoy. I'm the Deputy Director at Make It Work Nevada, Make It Work Nevada Education Fund. We build power around economic justice, racial justice, and reproductive justice. Part of the mission of our organization is to advocate for the health and vitality of our community members, and AB 256 is anchored in that intention. We're facing a national maternal health crisis in this country, as the United States is the most dangerous place in the developed world for an expectant parent to give birth. Let that set in. The reality is even more dismal for Black women who die at disproportionately higher rates than their counterparts. 43 Black women die every 100,000 live births, and that's just unacceptable in the greatest nation on earth. When I first learned of this statistic, it devastated me. It devastated me because I know how I feel about my own mom. It devastated me because I couldn't help but think about all the future Nevadans that would be born into this world without their mothers. I was overcome with grief, wondering how many of these children would never know the unconditional love and comforting warmth of their mama. It didn't take long for us to find out that the national trends that we're facing as a country are particularly present right here in Nevada. We conducted field research and a series of focus groups in order to best understand the health needs of our community members. Our Black Women's Agenda Survey, a survey of more than 1,000 Black women in Nevada, discovered that more than a fifth of respondents reported maternal health as their most preeminent and pressing issue. We also found that 1/5 of respondents reported feeling like they had no control over their body or the decisions associated with their body. In the series of focus groups we hosted, we were able to dig a little deeper. It was in these conversations that we learned the troubling realities that postpartum has on new parents. The women and birth parents we spoke to talked about feeling stressed, fatigued, and experienced hardships with chest or breastfeeding, amongst other hardships that a non-medical doula would be aptly capable of supporting a parent through. In these same conversations, nearly a third of our participants reported not having access to prenatal care and prenatal services at all. Finally, these conversations culminated with our community members revealing that doulas would be the most helpful resource during pregnancy, alongside parenting classes and additional resources to help them with postpartum depression. Our research and conversations resulted in the pursuit of this legislation. Expanding Medicaid to provide doula services to mothers and expectant parents is one of the best ways to help mitigate subpar birth outcomes, ensure new Nevadan children are getting a healthy and thriving start, and serve as a cost savings measure for our state. There is immeasurable value in having support, guidance, and an ally when navigating all the logistics, uncertainty, and newness of childbirth. Furthermore, research has found that mothers and expectant parents that have access to doulas have improved birth outcomes and improved overall health. AB 256 is community-driven policy. At its core, it's about the type of future we want our Nevadan children to have. Hopefully, it's one where we see value in their lives before they even arrive. Hopefully, it's one where we ensure that their mother or birth parent has access to any and all the resources that not only can ensure a safe and healthy birth, but also ensure a postpartum period that is met with support and ease instead of trauma and stress. We can do something about this, and we should. Thank you for your time and attention, and I'm now going to turn our presentation over to one of our community partners, Jolena Simpson, with the Kijiji Sisterhood. Thank you.
Go ahead, madam.
Thank you. My name is Jolena Simpson, and I am the president of Kijiji Sisterhood. Kijiji Sisterhood is a nonprofit in Las Vegas that supports Black and Brown birthing people through the prenatal, birth, and postpartum process. Today, I am speaking in support of AB 256. I want to talk about the real and tangible and necessary support that having a doula provides in our communities. Doulas are a bridge for our birthing families. We sit in the living rooms and we hear the concerns, the hopes, and the birthing plans. We build relationships that connect to the heart and the desire of birthing families as they work to bring a healthy baby into the world. Doulas are coach, confidant, teacher, and hype man. We stand beside and hold space for our strong birthing people. Through education, conversation, and support, we provide vital connections to understanding and navigating the birth process. Doulas provide support and advocacy in ways that our medical system often cannot. We feed the humanness of the birthing person. We care for them in community because we care deeply for our communities. Research shows that doula care can help mitigate some of the negative social determinants of health, such as poverty and systemic racism, which can negatively impact birthing outcomes. Doula care provides clients with a sense of agency, feelings of personal security, respect, and autonomy. Doulas provide knowledge transference and connectedness. In communities of color, rural environments, and low-income communities, this translates to better birth and postpartum outcomes. Unfortunately, support is not always available in our under-resourced members of our community, because the cost of being poor is very high, and their working dollars go towards maintaining households and navigating tenuous financial circumstances. But having a doula shouldn't be a luxury. We provide a continuity of care that brings community with us when we step into the hospital with our clients. We also provide support and resources to our clients when they go home. We have eyes on, hands on, and hearts on our clients. We stand in the gap to provide resources to protect a birthing person and their new baby. Because we take time to build relationships with clients, we are often the first call when they have questions or concerns. We reaffirm them as parents and connect them with medical providers and community resources, such as lactation professionals, affinity support groups, and mental health providers. Doula work is work. I have been a birth professional in Las Vegas for 18 years, and I've seen families choose unsupported birth and postpartum because they were unable to finance it. I have personally sat in the living room with postpartum families with mothers who are exhibiting suicidal ideation, and I stayed with that mother until their partner could get home and provide support. We connected them with emotional support, educational support, and medical support, and with their permission, provided reports to their care provider so that they could be brought into the loop to support that family. Doulas spend hours in direct one-to-one care with each client. Doulas in communities will often reduce their fees or go unpaid to support families at their own financial expense. Paying community doulas is one way to support health and economic well-being within our communities. Simply because a birthing person is unable to pay for the expanding rates of private doula care does not mean that they are any less deserving of this protection and support. By allowing equitable Medicaid reimbursement, we will be able to serve our communities in a way that is financially viable for both the birthing families, the community, and the doulas. Thank you.
Thank you. You have another presenter?
Thank you, Chair. At this time, I'd like to go to the phone. We have Lauren. I'm going to say her last name improperly, so I'm just going to stick with Lauren until I can get it up right. Lauren provided, if the folks in the broadcast can help, there is a PowerPoint that we provided on that Lauren provided to us. Do we have that available? We sent it as a backup.
Do you have their last three numbers so the PBS can figure out who they are?
Well,
there's a
stand by.
Call a friend in the back who's got it. (178) is the last three phone number digits.
Thank you, Chair Hardy and committee. Will the caller with the last 3 digits of 178 please slowly state and spell your name for the record?
Hi there. My name is Lauren Calagridis, Lauren, last name Calagridis, Kalogridis.
Broadcast, can we put up the
thank you so-
PowerPoint for Ms. Calagridis now?
The chair is going to make a decision. We're convinced without a PowerPoint. Thank you.
I'm also happy to speak off the cuff without the PowerPoint, and folks can follow up with that as a visual aid. Thank you so much for inviting me here today. Hi, everyone. My name is Lauren Calagridis, and I'm calling to voice my strong support of AB 256. I'm a psychotherapist focusing on perinatal mental health in Northern Nevada, as well as a doula with Reno Doula Project and Bright Heart Birth. I'm also the program manager of Thrive Wellness of Reno's It Takes a Village program, which is the only intensive outpatient mental health treatment program in Nevada that specializes in the treatment of perinatal mood and anxiety disorders, which impact upwards of 20% of birthing people, many other partners, and those numbers are disproportionately high during the pandemic as well. In my role at Thrive, I see connections every day between high rates of perinatal mood and anxiety disorders and corresponding birth trauma, lack of social support, cesarean births, and other factors that doulas can directly reduce and positively impact. Doulas are also key referral sources that get parents to us who are struggling and link them to the kind of psychiatric and medical support, as well as community resource supports that they need and deserve. They leverage the trust and deep knowing they have of their clients in order to connect them to the care that is needed when things are most dire. Beyond the central goal of preventing human suffering related to perinatal mental health struggles, it is also reasonable to assess that doulas pose additional cost savings potential in terms of preventing and lessening the need for additional psychiatric and mental health treatment postpartum, which many insurers are paying for at great length. In this way, doula coverage is a powerful intervention that meets the Department of Health and Human Services' triple aim of improving health outcomes, quality of care, and cost savings. Doulas offer the continuity of care and strength-based, human-centered support that our healthcare system is sorely missing in many cases, and which disproportionately impact the most at risk in our communities, including folks on Medicaid. I truly believe that the expansion of Medicaid coverage in the state of Nevada would benefit all parties involved, from healthcare providers looking to improve birth outcomes, to overextended nurses on labor and delivery floors, to insurers looking for cost-saving opportunities, to doulas that are hustling out of pocket to make sure that people in their community access the support that they deserve. And of course, most of all, the birthing people themselves who deserve to have experiences that are supported, safe, and dignified. Thank you so much.
Thank you. Or is there another person that you want to present unnecessarily?
No, sir. I believe if you have any questions regarding the financial impact of this, we have the awesome Mr. Dwayne Young and his staff on video. If you all have any questions, we're more than happy to answer.
Yeah, thank you. We have a exhibit, PowerPoint exhibit attached, as well as we have this wonderful summary of the methods of state savings, and we see the fiscal note that is a negative fiscal note. In other words, this is going to save money, and I may be taking somebody else's thunder, but I don't mind if they don't say anything. Any questions of the real chair has a question.
Thank you, Chair Hardy. I appreciate the opportunity. So unlike the first two bills that we heard this session, it looks like doula services are not an eligible service for Medicaid automatically, and that it requires that we apply for a waiver. And so just wanted to have whoever is best situated, who I suspect will be the fabulous Dwayne Young, to walk us through the process for applying for the waiver and what the conditions of that waiver are.
Yes.
Good afternoon. Dwayne Young, Deputy Administrator for the Division of Healthcare Financing and Policy, for the record. The language in the bill is written as a state plan or waiver. The good news is we do not have to apply for a waiver for these services. We can actually add this through the state plan process. And so it does not have that additional financial impact and is much easier to do.
Fantastic. So the intention then would be to put this in the next SPA state plan amendment?
Again, Dwayne Young for the record. Yes, I believe the effective date is for the first of the year. And so in the interim, we would work with stakeholders. There is a provision within the bill that says we determine the enrollment based off of our work with stakeholders. There's several different national recommendations and certifications that we would apply that to. We would build the state plan as well as the corresponding policy and have that ready to roll out at the top of the year.
Fantastic. Thank you.
Thank you. Any other questions? And thank you both and all 4 and 5 or 6 that may not have all been able to say something, but we would take anybody who wants to prolong this, that wants to be in the room and say something very briefly about how much they love this. And then we'll move on. Was I too subtle? Go ahead.
Good evening, Chair and members of the committee. For the record, my name is Christine Saunders, and I'm the Policy Director with Progressive Leadership Alliance of Nevada, here in support of Assembly Bill 256. Nevada has made a commitment to addressing maternal mortality in the state, but there are still women who have been left behind. According to the National Academy for State Health Policy, Black and Indigenous women are 3 to 4 times more likely to die from pregnancy-related causes than white women. Doulas are an effective part of the healthcare system. Culturally competent doulas are able to provide support and care to improve birth outcomes for women of color. Data shows that doula-assisted mothers were 4 times less likely to have a low birth weight baby, 2 times less likely to experience a birth complication involving themselves or their baby, less likely to require a cesarean section, and significantly more likely to initiate breastfeeding. Medicaid coverage of doula care will ensure that all future Nevadans, regardless of their family's economic status, are born with the best possible health outcomes and support from the state. We urge your support. Thank you.
Thank you. Kendall Lyons, Director of Health Policy for Children's Advocacy Alliance. I will keep it very brief and say that we just want to go on record reaffirming our support for AB 256, and we thank you for your support.
Thank you. Next. Next and next.
Thank you, Chair Hardy and members of the Senate Health and Human Services Committee, Reagan Comis with R&R Partners representing Anthem today. I just want to voice our support today for AB 256. According to America's Health Rankings, Nevada ranks 46 of the 50 states when it comes to women and health, children's health, mostly due to the state's low position of population ratios. We also recognize that women who are Medicaid beneficiaries are at the highest risk of poor birth outcomes in the United States, and women of color are especially vulnerable and face many barriers when accessing doulas. For these reasons, Anthem and the Reno Doula Project are working together to launch a new maternal health project in Washoe County with the intentions to expand. That makes doula services available to our beneficiaries at no cost. As we look for ways to improve Nevada's maternal health and infant rankings, we support innovative solutions to improve health outcomes and believe that doulas can help decrease mortality and improve birth outcomes for women and infants covered by Medicaid. Thank you.
Thank you.
Good afternoon, Chair Hardy, members of the committee. My name is Jimmy Lau with Ferrari Public Affairs, representing Dignity Health St. Rose Dominican. I'll keep it simple. We support. Thank you.
Gold star. Thank you. Any other people in favor in the room? Those in support on the phone, if you would open that up.
Thank you, Chair. Callers, if you'd like to provide testimony in support, please press *9 now to enter the queue. Will the caller with the last 3 digits of 433 please state and spell your name for the record? You may begin.
Hello, Chair and members of the committee. For the record, my name is Amber Falgout. That is spelled AMBERFALGOUT, and I will keep it very, very short as well. I am the Northern Nevada Manager with Battleborn Progress. We are fully in support of Assembly Bill 256. Expanding coverage for doulas is right for Nevada mothers, especially mothers of color. They need this support, and we urge the committee to pass this measure. Thank you. Have a wonderful evening.
Thank you. Next.
Will the caller with the last three digits of 874 please state and spell your name for the record? You may begin.
Hi, good afternoon. For the record, my name is Cristina Hernandez, CristinAhernandez, and I had something really profound written, but Jolena Simpson did a wonderful job making the case for doulas. And I just urge you all to support this bill. And thank you so much to Assemblywoman Summers Armstrong and to Make It Work for pioneering this.
Thank you. Next.
Will the caller with the last three digits of 795 please state and spell your name for the record? You may begin.
Hello, Mr. Chairman and the committee. For the record, my name is Emily Barney, spelled EMILYBARNEY. I currently work in the Reno Tahoe area as a birth and postpartum doula with Bright Heart Birth Services, the Reno Doula Project, and as a member of the Anthem Medicaid Pilot Doula Program. I'm, again, a voice of many, and everyone has done an incredible job of advocating for doulas in the community. And so I will just say that I'm in strong support of AB 256, especially for the families of color who have not had access to doulas for far too long and need to have more resources in order to improve their birth outcomes and decrease the likelihood of negative birth outcomes in the maternal mortality crisis that is currently happening in our country. So I strongly, strongly, strongly support this bill. Thank you so much.
Thank you. Next caller, please, in support of AB 256.
Will the next caller with the last three digits of 585 also please state and spell your name for the record? You may begin.
Hello, my name is Sarah Jewelton. For the record, that's SarahGeowalton. I am representing Bright Heart Birth Services, Biggest Little Baby, the Truckee Meadows Birth Network, and the Reno Doula Project in Northern Nevada. I'm currently sitting director at Reno Doula Project, which was started in 2012 as a way to help parents access doula support. Historically, having a doula was one of a thing that only people of privilege were allowed to access. The Reno Doula Project mission is to close the gap in access by reducing the cost of a doula through an income-based sliding scale, ensuring that families of all income levels are able to hire a doula. This is an incredibly important and personal goal of mine. There is no doubt that doulas provide a necessary service. Birthing people who have doulas attend their births have lower rates of unnecessary interventions during labor and higher rates of birthing satisfaction. In addition to the Reno Doula Project, I'm also a birth and postpartum doula, a certified childbirth educator, the owner of a local family resource center, and the owner of Bright Heart Birth Services. Bright Heart works tirelessly to make the role of doula a legitimate within this field. We are not medical professionals, but we are professionals. Careful attention to scope of practice, continued training, and commitment to our clients before, during, and after labor has paved the path for doulas to be well regarded in my community. I am happy to testify in support of more doulas being at more births. I thank you for your time today and ask for your support in AB 256 to include doula services as a Medicaid covered benefit statewide for my home state of Nevada. Thank you.
Thank you. Next caller, in favor of AB 256.
Will the caller with the last three digits of 456 please state and spell your name for the record? You may begin.
Hello, for the record, my name is Jenna Cole, JENNA COLE. I'm a postpartum doula and I work with Bright Heart Birth Services and I support this bill. Thank you.
Thank you. Next caller.
If there are any additional callers who would like to testify in support of AB 256, please press star 9 now to enter the queue. Caller with the last 3 digits of 157, please press star 6 to unmute yourself. Thank you, caller. Please state and spell your name for the record. You may begin.
Hello, my name is Katie Neese, Katienease. I'm the Clinical Quality Associate Director for Health Plan of Nevada Medicaid. For the record, we are pleased to support Bill AB 256. Our focus and commitment is to help people in the community overcome health disparities and improve birth outcomes. As part of this effort, we just launched a doula pilot in Clark County this month to provide peer support to pregnant women during pregnancy, delivery, and postpartum. We are working in collaboration with OBGYN providers to assemble this birth team. Our aim is to surround the expectant mother with support to meet not only her physical needs, but also her emotional and psychosocial needs. As we began having these conversations in the community with doula organizations, the cost of training and certification was identified as a barrier. To address this barrier and support diversity in the workforce, we are providing scholarships to become trained certified doulas. Thank you.
Thank you. Next caller. In support of AB 256.
Thank you, Chair Hardy. At this time, there are no additional callers wishing to provide support for Assembly Bill 256.
Thank you. Is there anybody opposed to AB 256 in the room that would like to come forward? If not, we will go to the calls. Anybody opposed to AB 256 on the phone lines?
Callers, if you would like to provide testimony in opposition to Assembly Bill 256, please press star 9 now to enter the queue. Once again, to provide testimony in opposition to Assembly Bill 256, please press star 9 now. Chair Hardy, at this time, there are no callers wishing to provide testimony in opposition to the bill.
Is there anyone in the room in neutral position on AB 256? Seeing none, we'll go to the callers to see if there's anyone in neutral position on AB 256.
Callers, if you would like to provide neutral testimony for AB 256, please press star 9 now. Once again, to provide neutral testimony for AB 256, please press star 9 now. Chair Hardy, at this time, there are no callers wishing to provide neutral testimony.
Thank you. Ms. Lynch on Zoom, would you like to say something in neutral?
Sure, Erin Lynch for the record, Division of Finance and Policy. I think you know that we are testifying in neutral and you already have a copy of our cost saving. Thank you.
Thank you. Appreciate that. Without anything further, Assemblywoman, would you like to say very brief closing comments?
Yes, I would. I know you didn't want to see the entire PowerPoint, but there's the last slide. If broadcast can just bring up the no, you can't have it? Okay. The last slide that I wanted to share with you all was a picture of Frau Busse and I. There were two pictures. One of them is of me as a young 25-year-old first-time mom, and a picture of Frau Busse and I in 2013 when I went back to Germany to visit with her to give her an update on the two beautiful boys that she helped me to birth and to check to see how she was doing. Birth professionals, whether they are doulas or midwives, really, really impact the lives of birthing moms. And I know you all understand how important this is, and I just would appreciate your support for this legislation. Thank you so much for your time.
Thank you. Appreciate you bringing this forward to us. Are there feelings on the committee? Take that as a motion. Do pass, Senator Ratty, and second by Senator Spearman. Any discussion? All those in favor say aye. Any opposed say nay. It's unanimous with all those here, and we will close the hearing and the work session on AB 256 and open the hearing on AB 192. Assemblywoman Cohen, would you like to come and present your bill?
Thank you, Leslie Cohen, Assembly District 29. And actually, Assembly Bill 192 is our bill. It came out of the interim committee from the 2019-2020 interim, from the interim committee on healthcare. And as you may recall, two of our priorities on that committee were public health and maternal and child health. And this bill addresses both. So the problem we have is that, according to the Centers for Disease Control and Prevention, or the CDC, sexually transmitted diseases, or STDs, can cause pregnancy complications and result in serious consequences for both the mother and the developing baby. In 2019, the CDC identified newborn deaths from syphilis as, quote, the most alarming threat, and emphasized the need to test all pregnant women for syphilis in line with CDC recommendations. And this is especially important in Nevada because in 2018, we had the highest rates of primary and secondary syphilis in the nation. And this problem is especially acute in the Las Vegas, Henderson, Paradise region, which had the highest rates of primary and secondary syphilis in all metropolitan areas that report to the CDC. We also had the second highest rate in congenital syphilis, which is when a mother with syphilis passes the infection on to her baby during pregnancy. And trends have not been moving in the right direction for us, unfortunately. According to the CDC, Nevada saw a 289% increase in congenital syphilis between 2015 and 2018. And congenital syphilis can significantly affect the baby's health. It can cause miscarriage, stillbirth, prematurity, low birth weight, or even death. Up to 40% of babies born to women with untreated syphilis may be stillborn or die from the infection as a newborn. Congenital syphilis can also result in deformed bones, enlarged liver and spleen, brain and nerve problems, and a host of other health issues. But the good news is that both syphilis and congenital syphilis are preventable. Syphilis can be treated and cured with antibiotics, and congenital syphilis can be treated, though babies who have it need to be treated as soon as possible to reduce their risk of serious conditions. And the key to treatment and prevention are ensuring that moms are tested for syphilis and receive prenatal care as necessary. And so what the bill does is it aims to align Nevada's STD testing requirements with CDC recommendations. I can go through the bill, or I know, nope, because you guys are good readers. Remember that. So with that, I can take questions. We should have on Zoom some HHS representatives. So, right, okay, so I see Ms. Kessler's there. So, yeah, I think we're ready to take questions unless Ms. Kessler would like to make any statements.
We'll be happy to see if the committee has any questions. Seeing one.
It's not even a question, it's a comment. It has been good to hear this work and follow this work from the interim committee on health, and I am grateful that you have shepherded it forward to this point in the session. I think that the data was compelling, and obviously the population that we're serving, there was a lot of focus on maternal and child health, and so just my gratitude to the chair of the interim health committee for continuing to focus on this and bring it forward. I think we decided this was one we didn't want to give up on, and here we are.
Is that a motion?
I think we have to do public testimony, Chair.
Thank you. Is there anyone else in support of your bill that would like to say something positive about AB 192 briefly?
I am not aware, Senator, but if I could briefly, Leslie Cohen, Assembly District 29, and thank Chair Ratty. We did a lot of great work over the interim, and thank you as well for that work. And I think the bills reflect the hard work that we did during the interim and the fact that they've been passing and doing good things. They'll start to do good things for Nevadans is reflective of that work of all of us on the committee. And I am not aware if anyone is in the room in support, but I'll certainly give up my chair for that.
Anyone in support in the room that would like to come forward and say something? Go ahead.
Thank you, Mr. Chair. Bradley Mayer, Bradley Mayer, partner with Argenta Partners, for the record. Look, this is an important bill. I just want to make brief supportive comments. I'm representing both the Southern Nevada and Washoe County Health District, but you heard a lot of the stats from Assemblywoman Cohen about Nevada's problem with syphilis, and really our STI rates are all very high across the board. You know, we're first for primary and secondary syphilis, and we're actually fourth for congenital syphilis. So this is an important bill. I think there's probably more that needs to be done over time. And so I think we'll have to continue to look at this. But for now, this is a great step that we're taking, and we just urge your support. Thank you.
Thank you. Anyone on the phone lines who would like to be in support of AB 192?
Callers, if you would like to provide testimony in support of Assembly Bill 192, please press star 9 now to enter the queue. Chair Hardy, at this time, no callers have indicated that they would like to provide testimony in support of Assembly Bill 192.
Thank you. Anyone in the room opposed to AB 192? Seeing none, anyone on the phone lines in opposition to AB 192?
Callers, if you would like to provide testimony in opposition to Assembly Bill 192, please press star 9 now to enter the queue. Chair, at this time, no callers have indicated that they would like to provide testimony in opposition.
Anyone neutral on AB 192 on Zoom?
This is Erin Lynch for the record. I'm with the Division of Healthcare Financing and Policy. I'm the Chief over the Medical Programs Unit, and we are testifying in neutral. And you should have a copy that our fiscal note is a $0 impact.
Thank you. And anyone on the phone lines in neutral position on AB 192?
Callers, if you would like to provide neutral testimony for AB 192, please press star 9 now to enter the queue. Chair, at this time, no callers have indicated that they would like to provide neutral testimony.
Thank you. Any closing comments by the sponsor of the bill?
Thank you, Leslie Cohen, Assembly District 29. Thank you for hearing the bill. And I also just would be remiss if I didn't thank Mr. Robbins and Ms. Kamlasia for all their hard work on the bill during the interim and during session. And also the, our HHS partners with the state who, brought us the bill and made us aware of this issue and also worked very hard on it. So, thank you.
Thank you. Any comments from the committee member? I would close the hearing and open the work session on AB 192. Move to approve by Senator Harris and second by Senator Spearman. Any discussion? All those in favor, please say aye. All those opposed, please say no. Motion passes with all those present. Thank you very much. Close that work session. And is there any public comment here in the room or on the phone lines?
Callers, if you would like to provide public comment, please press star 9 now to enter the queue. Chair Hardy, at this time, no callers have indicated that they would like to provide public comment.
Thank you. As far as public comment is concerned, I think this is the last time I'm going to chair a committee meeting. The legislature, thank you very much, Real Chair Reddy, and we will call this meeting adjourned.